I'm going to turn it over to a woman who needs no introduction, Deputy Secretary for HIE, Pamela Lane.
Thank you. Someone said to me, so what's your title? I said, it's Pam. And that's all you need to know. So I'm going to, as my handlers know, I'm going to go off script right off the bat and say, because they expect me to do that, yes, don't they? So I'm going to do the same thing I did yesterday for one of our meeting. And so, gentlemen, if you are comfortable with this, I'm declaring this a no-tie zone. So if you are comfortable without your tie, you feel free to remove it. If you are more comfortable with it on, or your boss is here and said you had to wear one, then you have to leave it on. Because there's going to be a lot of information that you're going to be trying to keep track of today, and I'm all about comfort, in spite of the fact that I'm wearing heels today, which are already killing my feet, but that's more information than you needed to know. I do have a couple of other things that I want to point out to you in the room. We have a mural representation back here on the wall of the California HIE story. And if you haven't seen it, please do so. On your tables, you will find stacks of Post-it notes. And if there is something that we have left off, something we overlooked, please feel free to write those on a Post-it note and stick it on our parking lots. I would caution you that the mural is in chalk and we did not have time to seal it, so don't get up against it. I've already been there this morning. But it is a fun way to take a look at what's happened in California from our very first pioneers in HIE, who are known to many, if not all of you, up to where we are today, and then, of course, what our destination for the future looks like. Karen pointed out to you the sponsor table. And I want to take a moment and thank our sponsors. We could not do this without their help. As many of you who have been engaged in federal grants know, you cannot spend money, you cannot spend federal grant money for food. And it's awfully hard to get a group of people together for the whole day without feeding them. And so our sponsors are near and dear to our hearts. And so I want to thank Altruit Solutions, Accession, the California Health Information Association, E2O Health, Greenberg, Trog, I knew I was going to say this one wrong. I was going to stumble on this one. The Traurig, Glaze and Associates, Health Tech Communications Group, the Santa Cruz Health Information Exchange, and Scientific Technologies Corporation. So please join with me in thanking them. I also want to thank those of you who participated in our food drive in coming here. It's really hard this time of year to have any group get together and not think about how fortunate we all are and those who are not quite so fortunate. And so we wanted to ask you to join us in supporting the Sacramento County Food Bank. And many of you have contributed. The day is not over yet. So if you feel so inclined and you were not able to either travel, we know that was an inconvenience to ask you to travel with canned goods. You can either make a quick trip out in town, or we are also accepting cash donations to help them with the work that they do as well. So with all of that, let me say welcome. This is our 5th ARA-funded State HIE Stakeholder Summit. It's so wonderful to have you all here, and it always is a surprise to me that we, in spite of having 4 of these prior, we always have new faces and new names and new friends to make as people join us. And I think it's probably a function of people being able to look up for a moment and go, oh, gosh, I haven't been watching that thing, HIE stuff, so maybe I need to do that. But whatever the reason that you're here today, welcome, and we're glad that you are here. I know that, and we've talked for 3 summits now, I know this is not easy. This is hard work, and your hard work, your dedication, your ability to keep your eyes on the road ahead has been amazing. It's been amazing to me to watch even before I was in the role that I'm in now and sat at stakeholder tables as a stakeholder and engaged in these conversations. It's amazing how much imagination you need to make something new like this happen. We're here today to look ahead, because we are coming to the end of the ARRA-funded efforts in California. Our actual end date for our work that's ARRA-funded is February the 7th. We have a fast and furious, slightly less than 3 months ahead of us with a number of projects, some that are just starting, that we will be reporting out to the ONC, the Office of the National Coordinator, as deliverables from California. This has been privately driven, publicly funded and assisted, and it's been a journey. And we've laid a lot of pavement. We're going to use that road analogy that you see on the mural and that you're about to see on this video throughout our day. We've put down a lot of pavement, but there's still more road to be laid. There's still more work to be done. But we'll keep on making progress where we can and when we can, and I will tell you that the feedback from the Office of the National Coordinator is they are, quite frankly, amazed at what California has been able to do in the short amount of time that we've had. When I recently spoke at a national conference and reminded them how big California is, and I put it in terms of the agency that I work in, California Health and Human Services Agency alone has 33,000 employees. And ONC said, gosh, you are kind of almost as big as us. And I said, yeah, kind of. And we do have all of the challenges across California that the rest of the country has. So with that, I'm going to stop talking. I'm not going to be your primary speaker today. I hope that you enjoy this video, and we're going to let people across California tell you their stories today.
It's a challenge to get your own medical records because they don't belong to me. I would rather it be simpler if it was safe for my information to be able to go from one area to the other.
For our patients, oftentimes we only have one specialist per field, and so the wait is very long. Or sometimes we, don't have specialists in that particular field that accepts our patients at all.
I know in my own experience in an emergency room, if they had known about my diabetes and how it was being handled, if they had known that I had been using an insulin pump, I think my treatment would have been very different. What happened was that based on blood work and observation, they had to treat me for a number of different things, which I didn't have. And that, in the end, turned out to be not such a good thing.
We have a lot of patients that go from the San Joaquin Valley and they travel out to tertiary care hospitals such as University of California, San Francisco, or University of California, Davis, even out to Stanford University. And a lot of times the information that's there sits there.
There's a lot of information on patients that is not being shared across the different transitions of care, and being able to share that information with their physicians is critical.
We are hopeful that the new primary care will be defined as a physician providing care for general well-being, mental well-being, and substance abuse services. So I think that triangle of services, so to speak, is what we think America needs, and what I think a lot of the Affordable Care Act brings.
The use of health information technology is definitely transformative. It's what we aim for. It's not simply about digitizing our paper processes. It's really about moving our processes to the next step and really transforming how we practice medicine.
Before, when we had just a paper record. When we were on call, we weren't able to access all of the patient's information, but now somebody calls, I can pull up their electronic record from home, and I can make a much more informed opinion, and it was like night and day in terms of the efficiency of my practice, but also the quality of care that I can provide to my patients.
A lot of times when we send our patients to a specialist, they worry. They always want to know right away, what do we need to do? What's the next step? Should we worry? And so with eConsult, we're able to get an answer for a lot of these questions within the next couple of days. So we're able to allay patients' fears much more rapidly, and then we're also able to come up with a plan for them and for us of how to move forward.
Health information technology is helping us deliver a better product.
Over the years, I've noticed a real change in how I interact with doctors and nurses and different health providers. And part of that is because of technology.
I think having the health information technology that we have now has really taken medicine to a whole new level for rural communities. Being able to monitor patients remotely, being able to visit with them remotely with telemedicine services has markedly changed the quality, also the cost effectiveness of care, particularly in rural areas that have been largely underserved.
Our health information exchange, we've been fortunate in that we have quite a large number of stakeholders that are participating in the HIE, but maybe that's 25% of our healthcare community. So we have a long ways to go.
More and more practices in this area are adopting an electronic health record, and my hospital, Enloe, has been moving forward with meaningful use and making great strides in that. So this health information exchange is just a natural extension of this community-wide interest in electronic health records and sharing information.
We decided we weren't going to wait. We were going to move the community forward. And that not only our community, but we've got 7 counties that's a part of our HIE today.
The primary thing is looking to engage all the possible stakeholders in your community, because if you build it but you don't have a lot of interest in it, it's going to sit there and simply be fallow.
The Health Information Exchange helps us tremendously in caring for our patients. So when a patient appears in our practice, we're seeing them after a discharge from a hospital, for instance. The usual process would be taking a couple of days trying to obtain the information from the hospital. Today with the Health Information Exchange, we can see the patient the day of discharge or the day after discharge and have all that information available.
Hurdles in the health information exchange space are very common. Challenges around data governance and where the data resides, who can see it, who has access to it. Those types of things aren't unique to this particular community. We've been able to overcome some of those challenges because of the willingness to be very inclusive.
When we first started this, we thought, well, why wouldn't everybody want to be involved? But I really think what will happen as more and more come on, success breeds success. In 3 years, we've gone from 0 patient lives in the health information exchange to over 9 million.
The light going on for a lot of doctors is the community opened up to them. A lot of times they're very focused on the patients they see within their area. What I've had is a lot of physicians say, oh my gosh, I just got 30 new patients. And they came in because I was able to access their data from the HIE. Watching their faces kind of light up when they find out, oh my gosh, I've been waiting for this data for so long.
It's an epiphany, so to speak, because before I didn't realize that I wasn't doing all I could. The more the physicians or healthcare providers can exchange information, the better care that's going to be delivered to the client.
Knowing what's happened to a patient, with a patient in this setting and any other setting, and having that data available to you at the time that you're making decisions, clinical decisions, can be really important. And that translates itself into the quality of the care you provide, how safe that care is.
Once we have real health information exchange, if we have access to the patient's records wherever and whenever we need it, that's going to markedly enhance the quality of the care, as well as the speed which we can react and decrease the cost of care.
I am excited because I think it's going to make things easier, more efficient. Better care will be given to me and my family because there's access to my information from the past.
Okay, now I'm totally off script. So, if you were in that video, or if your organization was in that video, or if your organization was someone who partners with organizations in that video, please stand up. Yeah, yeah, there you go. All right, okay, let's give them a round of applause because they put it out there for you. Thank you. Thank you so much. And for those of you who don't have your HIE up and going, those are the folks you want to talk to. So maybe I should have them stand up again, but they won't do it again. So I just hope you took notice. So thank you. Thank you so much for being the voice of HIE in California. I'm not the face or the voice. I'm just the orchestrator of this. And so you listened and were willing to step forward and tell your story. And I really appreciate that. There are a lot more stories to be told in California. And that's why we're here today. People are going to come up here on the stage. They're gonna be vulnerable, step out there and tell their stories. And I hope that you will greet them and appreciate for many people how difficult it is to do this, to step up here and speak in public. So the roadway continues. We've pictured it, the road into the future on our mural. We have an incredible agenda today. It's very rich. It's very packed full of information for you. And I'm going to just roll right into the first panel. And so, if you take a look at your agenda, you all should have a packet. If you don't, please raise your hand, and we'll get this to you. In your packet, you're going to have some information that is going to tell you who was here today, so that if you didn't take note of folks who stood up, you can put little stars beside their names that were in the video on your participant sheet. And I have found in the last 18 months in this role that I've been privileged to have that this is a very sharing and caring and open group. So there is no stupid question, and people will help you if you let them know that you need help.